know this is a really nice example of our physiotherapists who's got deeply involved in bad science over the last 2 or 3 decades and misinterpreted poor data to come out with some ridiculous notion that you could prevent somebody from having a stroke by turning the neck round and asking if they go dizzy or something like that, which is a ridiculous concept. Is there any Australians, before we go into this, are there any Australians in the room? Oh, sorry. They're really good, Australians are. Anyway, not to be too disrespectful, but we think that the APA guidelines, for example, only partially fit within the evidence base of what is known beyond this condition, and the IFOM guidelines, we'll talk about this later if you want in the workshop. But what supersedes all of that is our ability to think for ourselves and reason through the clinical problem and use the evidence to as best as we can, and look at this interaction between true vascular pathologies and the sorts of patients we see as manual therapists. So this is the group we're concerned with, vascular patients who look like musculoskeletal patients. And now I'm going to put a picture of the Norwegian wood up while Alan comes and tells you a little bit more about